Pacifiers, the good, the bad and the ugly. As parents, a lot of us will give pacifiers to our babies, but we will also wonder, are there any drawbacks? Well, today I'm going to talk about the benefits of pacifiers and what the downsides can be. But most importantly, I'm going to tell you how you can use pacifiers to reap all the benefits and avoid all of the drawbacks. So why do pacifiers work so well? Well, babies love suckling. They have a really strong suckling reflex when they're born because this helps them to feed. Sucking can actually soothe them, it keeps them calm, and it helps to regulate them. Babies would often suckle at the breast, and we call this non-nutritive suckling. So they're not sucking because they want any milk, they're just after that soothing, calming effect that suckling can give. If you're not breastfeeding, or if you are breastfeeding but you don't want baby to be constantly sucking, then pacifiers can be really beneficial. So what are the good points about pacifiers? Well, it keeps them happy, it keeps them settled, it soothes them, and it can help them sleep. All of those things are essential when you've got a new baby and you're trying to get a bit of sleep yourself. But it can also help with their tongue development because they're using their muscles to suck. If you have a baby that has a lot of reflux, it can actually reduce how much reflux they're having because that constant sucking that they do helps to keep the regurgitant contents down. And some studies show that it actually reduces the incidence of sudden infant death syndrome, SIDS. So lots of benefits there. So what are the negatives to having a pacifier? Well, a lot of the negatives are associated with prolonged pacifier use. So beyond those first 6 months of life. One of the key issues that we see is poor oral motor development if babies are sucking on a pacifier for too long. So babies need to be able to move their tongue, their jaw and their muscles freely. But if they have a pacifier, then that can actually stop them from doing that. And that movement and developing those muscles is really essential for them to develop those skills later on that they're going to need for feeding and also for speech. So it can impact that. It can also stop them from playing and exploring. So when babies are first born, they have a lot of control over their mouth. They need that because the most important thing that they do is feeding. And because they have so much control over their mouth, this is actually how they explore the outside world. So you'll know that little ones like to put everything into their mouth. They like to put their fingers into their mouth. But when they're doing that, it's helping them to develop their gross motor skills and their fine motor skills, and also the muscles that they need for speech and language and feeding later on. If they're constantly sucking on a pacifier when they're meant to be playing, then actually you're taking away those opportunities to learn and explore. Prolonged use can also cause an increased incidence of middle ear infections. This is all to do with the positioning of the tongue, and the tongue doesn't have the correct position if they're constantly sucking on a pacifier, and that increases the risk of them getting middle ear infections later on throughout childhood. And the final downside is that it can cause misaligned teeth. So as I mentioned, when you have a pacifier in the mouth, it does affect the positioning of the tongue, and this can affect how the mouth and the jaw grows. And if the jaw and the mouth doesn't grow as it's supposed to, then it can cause things like overcrowding and overbite and misaligned teeth, for which they may need corrective treatment later on in life when they're older. So how can we as parents reap all the benefits of a pacifier and get that much needed sleep in the first few months of life, but avoid all of the downsides? Well, you just need to follow these really simple tips. Don't introduce a pacifier too early. Make sure that your baby is fully established on breastfeeding or bottle feeding before you do. And you also need to be aware of when they're hungry and when they're unsettled. If you give them the pacifier when actually they're hungry, then they're not going to be getting all of the milk that you need. So wait a few weeks. And official guidance is to wait until your baby is 4 weeks if you're breastfeeding. That gives you ample time to make sure that baby can breastfeed very well. And also as a parent, you're able to pick up on those cues of your baby being hungry or your baby just needing a little bit of settling with a pacifier. When you offer your baby the pacifier, give it to them to help soothe them, but don't let them fall asleep with it in their mouth. Otherwise, they'll develop a positive association with having the pacifier in their mouth and sleeping. And this can cause all sorts of troubles later on when the pacifier keeps coming out and you have to wake up constantly throughout the night to put it back in their mouth. So use it to soothe them, but when they're just about to fall asleep, take it out of their mouth and leave it out of their mouth unless they need settling again. A lot of the downsides of pacifier use are actually because baby has prolonged use of the pacifier. So trying to get rid of the pacifier as early as possible is a good way of avoiding all of those. Once your baby gets to about 5 months of age, their suckling reflex really fades. So that's a good time to start reducing how much they're using the pacifier. So when they get to about 5 months, start using other ways to settle them when it comes to sleeping. So hushing and patting them and getting them to self-soothe is a good way of not having to use the pacifier as much. Slowly reduce how much you're giving it to them by about 5 months of age. And then over the next few months, only give it to them when you're putting them to sleep, or avoid if possible. The best time to remove the pacifier is when they are 6 months, if not then 12 months at the very latest. If it goes beyond that, then we really are looking at much higher risks of misalignment of the teeth, ear infections, and then issues with feeding and with speech articulation later on. I hope you found this information useful. I think we can all agree that pacifiers are great for babies, but we just want to avoid using it for too long and not letting your child develop as they should. I hope you found this useful. For more tips and information on parenting and child health, please follow me at Dr. Gina Parenting. I'm on Instagram, Facebook, and YouTube. I'll see you next time. Bye.